Okay guys, this last video of the respiratory system, we're going to talk about normal and abnormal breathing, and of course some of the things that can go wrong with the respiratory system. Now, normal breathing will consist of about 12 to 20 breaths per minute in a normal adult. Okay, that can change by age, activity, size of the person even, but between 12 and 20 breaths is considered normal. Now, if we look down here and below, you can see that there are a whole bunch of terms here that describe abnormal breathing. And when we're talking about abnormal breathing, we're talking about stuff like how deep we're breathing in. So are we taking a full deep breath, or are we breathing in really shallow? Is the rate of breathing going really high? Is it above 20 breaths per minute, or is it going really low? Is it below 12 breaths per minute? Does the breathing stop for any period of time? Or does the patient find breathing very difficult? All of these things are explained. You can see the different terms there. I'm not going to test you on these terms, but just keep in mind as we talk about these conditions that, what can go wrong with the lungs. Think about these different types of breathing, fast or shallow, slow or labored or difficult, or breathing stops for a certain period of time. Just keep that in mind as we go through, but don't expect to see any of these terms on a test or a final exam. Okay, now I do want you to know, of course, what can happen if we do have abnormal breathing for long periods of time. And there's 4 conditions listed here. The first one here is cyanosis. I think this one's a pretty easy one for people to remember. Cyan, it means blue. Okay, so cyanosis is when we get a bluish color of the skin and the mucous membrane. So your lips, for example, would start to turn blue, and this is because the tissues are getting insignificant oxygen. Okay, so not enough oxygen is reaching those tissues in order to keep them pink or red, and as a result of that, we would expect to see low oxygen in the tissues. Now that leads to a condition that's called hypoxia. Hypoxia is when we measure the oxygen levels of the tissues, and it's lower than normal. It's lower than what it should be. So hypoxia refers to low normal oxygen levels in the tissue. Hypoxemia is a condition when we have low oxygen concentration in the arterial blood. For some reason, even the arteries, we're not getting the right amount of oxygen into those arteries. So there could be an issue with the way the patient is breathing or exchanging gas. And then the last one there is suffocation. Of course, suffocation means the person's not breathing at all, and that's a pretty serious condition, as you can imagine. Now, we can also have some disorders of the respiratory system. I'm sure some of you guys have allergies. Could make breathing your chest a little bit tight, or sneezing, or hay fever. You can have infections. Our lungs are a really great place for bacteria to grow. So it's a bad thing for us to get an infection in the lung. Stuff like pneumonia can be really, really serious. We can have things like chronic obstructive pulmonary disease, and that's often just abbreviated COPD. And we're going to talk about that in a couple of slides. We can have a condition called SIDS, which is sudden infant death syndrome, and this happens when, for some reason, usually in the nighttime, when a baby is asleep, an infant, they stop breathing and they die. It's often called crib death, and it can be really, really horrible condition, because a healthy baby goes to bed and the baby doesn't wake up in the morning. So that's terrible. We can also have RDS, which is respiratory distress syndrome, and this is a condition we see in infants, babies. Normally we see it more common in premature babies, and this is a condition where the lungs aren't quite strong enough. They're lacking components to keep them open. So as a result, the lungs don't stay open, and we can't get efficient gas exchange. There are ways to treat this, but it is something that you certainly need to monitor. Of course, we can get cancer of the lungs, and smoking is a huge factor that increases lung disease, and more specifically cancer of the lungs. And we can also have pleural disorders. Now, remember, the pleura is the membrane that surrounds the lungs. So the pleural cavity is the space between the lungs and that connective tissue membrane, the pleura, which protects the lungs in the thoracic cavity. Now here are a list of some of the more common viral and bacterial infections we can get. Every one of us has had the common cold, so it's a viral pathogen, of course, and it infects the mucous membranes of the respiratory system. And you can get a cold that's based in your head, which is based in your sinus cavities, or you can get it on your chest, which it's moved down to a lower respiratory tract infection. Generally, our immune system will fight off a cold in a week to 10 days, maybe 2 weeks for a particularly bad one. Another type of infection is called RSV, or respiratory syncytial virus. So this is a viral infection of the lower respiratory tract. It's very common in infants, and it can be quite serious. So it usually requires a hospital stay. We can get a condition called croup. So we get an infection that kind of constricts the airways in the lungs, and that results in, when breathing, taking normal breaths, we hear a kind of a loud bark almost. The cough is a very loud bark because of that obstruction. Influenza, the flu. This is a more serious virus. We all kind of know what the symptoms of the flu virus is. It can be quite serious if it's particularly virulent. So it was something that you wouldn't play with. You'd actually go to the doctor and hopefully be checked for any secondary infections or anything like that. It generally causes a swelling of a large portion of the respiratory system, which can hamper breathing, make it a little bit more difficult. Pneumonia is a disease in the lungs. It's generally caused by a bacteria, and it generally produces an exudate, which means the bacteria in its waste products or its metabolism, it produces a mucus or a slime that affects the efficiency of the lungs. And the last one there is tuberculosis. Of course, this is a really severe disease. It's caused by a particular type of bacteria called the Mycobacterium tuberculi, and that bacteria behaves very different in the lungs than most, and it leads to a very severe lung disease, of course, that we call tuberculosis. And it has killed a lot of people in the past, and right now it's actually coming back. We're actually seeing some drug-resistant strains of tuberculosis, so that's a condition health authorities are looking out for. Now back to COPD, or chronic obstructive pulmonary disease. This is a blanket term that we use to describe a lot of different lung disorders, but a couple of them are listed here. Chronic bronchitis. So this is when we have inflammation and excessive secretion of the bronchi. So it makes breathing quite difficult because the bronchi aren't able to do what they're normally supposed to do. Another condition there is emphysema, and emphysema is another condition that we get as a result of smoking for long periods of time. And what happens are the alveoli, the small structures of the lungs, they dilate, so they get larger and they get bigger. And as a result of that, they end up being destroyed. So emphysema leads very often to people with a barrel-shaped chest. Their chest gets quite big because of these changes in the lungs. And emphysema is a deadly condition. It needs a constant look at by medical professionals. So in COPD, for some reason, and these two conditions are listed here, but there's an impairment or obstruction to normal airflow. Okay. Generally, this will happen in the smaller airways. So we're talking about the alveoli or the alveolar sacs, and then as the condition gets worse, it'll move on to bigger and bigger structures, like, for example, the chronic bronchitis. That's actually affecting the bronchus, which are the big airflow structures in the lungs. Now, allergic responses, of course, these are stuff you're quite common to. If you're sensitive to a particular allergen, it causes a minor, in some cases minor, sometimes major immune response, and we'll start to see stuff like asthma, hay fever, and some of the symptoms are, inflammation, watery eyes, sneezing, increased mucus secretion. You can have spasms in the bronchial tubes, which can be pretty serious. Anaphylaxis is a condition of severe allergic reaction, and that's when breathing can actually stop. And the worst thing about allergies is very often it's hard to identify exactly what's causing the allergy. So you can do your best to avoid it, but you're never positive exactly what's causing the condition. Now, one of the last ones we'll talk about are pleural disorders. So even if the lungs aren't affected themselves, the space outside the lungs can have an effect on the efficiency of the workings of the lungs. So the first one there, pleurisy, is when we get inflammation of the pleura. Now, depending on how the pleura, so remember that's the membrane that surrounds the lungs, depending on how inflamed it is, swollen or painful, it can cause problems breathing. A pneumothorax, this is when we get air building up in the pleural space, so the space around the lungs. Now, what will happen in this case is the air, of course, it can't compress because it's inside a space, so what will happen is it'll put pressure on the lungs, and it can result in a collapsed lung. So that's a pneumothorax. Now, a hemothorax is when we get the same condition, except now we've had blood in the pleural space. So something's happened inside the body. We've got bleeding, interior bleeding, and the blood fills up in the pleural space, and that's going to put pressure on the lungs. In some cases, when we get a buildup of gas or blood or fluid in the pleural space, it puts so much strain that the patient can't breathe, and we need to drain that fluid or blood. So often a chest tube is inserted, so we put a cut through the intercostal muscles between the ribs, and we cut through the pleural cavity and the membrane, and we put a tube in there. And that procedure is called a thoracentesis. So this is a picture showing a pleural effusion, which means that something has got inside the pleural space, and you can see now the lung doesn't have that extra space where it can expand into the cavity, and as a result that lung gets pushed and there's pressure put on that lung. So it's highly unlikely that lung can ventilate correctly, or if at all, and if this pressure keeps on building, we could see this whole lung collapse and it won't work at all like it's supposed to. We'll have to focus the breathing on the healthy lung on the other side. Now, some of the common equipment and treatments we use when we're talking about the lungs are a bronchoscope. So this is a camera that we can put in and we can have a look at the bronchi. We use oxygen on patients for a lot of different ailments, and what it does is it increases oxygen concentration in the blood, which makes sure our metabolism is working well, which will help our immune system. You can have suction apparatus, so if mucus is building up in the respiratory system, you can use suction to remove it. A tracheostomy, this is when a tube is inserted into the airway as an artificial airway. So for some reason the regular airway isn't working, we can add this tube in order to help respiration. We can have artificial respiration, so what you learn in your first aid classes, artificial respiration, so that's part of CPR course. So when breathing stops or we got loss of normal function, we can have artificial respiration. And then the last thing there is sputum analysis, and this is when we take a sample of the mucus of the respiratory system and we send it to the lab, and we perform a bunch of tests to find out what's present or what's not present in the lungs, in the respiratory system, and from there we can make some diagnoses on what the condition of the patient would be. And that's the end of Unit 11.